Hello.
Hi, nice to meet you.
What is your name?
My name is Samuel Millett.
Tell me about a time in clinicals at FTCC in which you delivered high quality, patient centered care to individuals, family groups, and communities in varied settings.
I had a patient who was visually impaired, fully blind, and I facilitated care by providing detailed instruction around her environment to help her better navigate it. I helped her to the bathroom, but I still gave her privacy so that she can maintain her own stuff.
Independence?
Independence, thank you.
Okay.
And I also met with her sister and we discussed her care and how she was the caretaker. And I also learned about their background and just became more involved with their entire situation.
Very good. So, okay. Can you tell me how you use something you learned from in one of your classes to incorporate best practice and professional values and standards into compassion in nursing practice?
Yes, I had one patient which was still getting tube feeding, but was also ordered to give solid food uh, orally. And so as I tried this, first I tested the waters with some orange juice, and I noticed there was a significant aspiration risk. So I brought this up and advocated that we should have a speech pathologist consult to assess her swallowing capability
Okay.
because just the danger of what I felt was a serious aspiration risk.
Oh, very good.
Thank you.
So, can you tell me an example how you have demonstrated cultural and global congruency in the healthcare environment with diverse populations and promotion of healthy lifestyle and preventative health screenings in clinical at FTCC?
Yes, I had a patient with a kosher diet. So I just made sure I inspected the food as it came in to make sure there was no mix-up, to keep away pork, shellfish, and make sure dairy wasn't touching meat in the same meal.
Very
And
good.
yeah,
Okay. Um, can you describe a situation in SIM or clinical at FTCC where you function as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration?
yes. So we had a patient in the sim that was going through cardiac failure and was having a STEMI and started to crash. I ended up having to participate as the nurse lead, so I called a code blue. I facilitated teamwork with all our different roles, including compression and respiratory use. I also had to designate what medications we had to administer, such as 1 milligram of
Atropine?
atropine. Thank you.
Okay. I think you did a very good job. That sounds really nice. So, another question for you. You ready?
Yes, ma'am.
Can you describe how you have demonstrated beginning skills in point of care, leadership, management, and care coordination using effective communication skills through either successful completion of a class project or clinical or experience?
Yeah, so we did a project on nurse-patient ratio on the relation to the outcome of patient care. So we all divided up our different tasks. Mine was writing, and also when we at the end of it, when it came together, we did a video in which I was responsible for the creative idea of what we would do with that, and then also had a team member do the videoing, and we had someone doing the acting. And we all participated in the video, and it actually turned out very well.
Oh, sounds like it did.
Thank you.
So, can you describe how you implement safe and competent care to individuals through both systems' effectiveness and individual performance in varied healthcare settings?
Could you repeat the question? I'm sorry.
Can you describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings?
Oh, yes. So I always try to maintain facility policy when going forward with my care. And I also like to always assess the problems before diving in on any solution. And I also try to keep a holistic approach to the patient treatment.
That's very good. Can you tell me about a time you received negative feedback on your performance in class, lab, or clinical, and what did you do about it?
Yes, I've been told sometimes I had to project more confidence. And so going forward, I try to be more assertive with dealing with my patients and talking to them. And because if they can see that I believe in myself, they can believe in me.
All right. How do you prioritize projects and tasks when scheduling your time? Give me some examples.
So I like to utilize a calendar, which I update every month with tasks that need to be done and what time, what date. And I just try to prioritize by due dates to make sure that everything is in on time.
All right. Can you describe a situation where you recognize a safety concern? What was it, and what did you do, and what was the result?
Yeah, so I had a patient who was HIV positive, and at the time I was doing a needle stick, and so I had to take precautions to not get stuck myself. And as I inserted the needle, he started thrashing about, and so I immediately had to take precaution by stepping real back so I wouldn't get hit, and I properly disposed the needle into a sharps container.
All right. Give me an example of methods you use to build a rapport with your patient and peers.
Well, I like to use a good sense of humor, but also just treating people with respect, because they're people just like everyone else, and everybody deserves respect. Being able to communicate on a personal level while also maintaining professionalism is just one of the cornerstones of good nursing.
Tell me about a situation where honesty and integrity were used to promote patient advocacy or safety.
Patient advocacy and safety. I feel like you have to bring that in every day, because if you're not being honest with your patient and you don't maintain your integrity, you're not going to do a good thing. But a specific example I would say was I had a patient who was dealing with the loss of a limb, and he had inflammation at that limb, and he wanted to go home really bad. And I had to break the news to him. I had to be honest. I told him, if you're unable to walk out yourself, you're not going to be able to go home today. And then he opened up and says, I want to go home to go die. So that was a moment of concern. So I had to bring that up with the doctor, and I communicated with them because they wanted him to go home that day. And I had to update them and advocate for his health, that he's in no condition to go home. And plus, he's making these statements. And after that, he was seen by 5 physicians in the next hour. So I hope I made a difference that day.
Right. That sounds good. Thank you for answering my questions, and I'll be back with you. Okay.
Thank you.